Hi, I'm Dr. Darren Hubert, and today we're going to talk a little bit about breast reconstruction. So breast reconstruction is surgery which creates a new breast on one or both sides. Typically this follows a mastectomy, which a woman will usually have for one of two reasons, either for breast cancer or as new genetic testing is becoming more widely available. Some women have genetic mutations such as the BRCA or BRCA gene and some other mutations that put them at high risk for breast cancer. So they may have what's called prophylactic mastectomies to remove the breast even though there's no cancer, because their lifetime risk for breast cancer may be very high. So breast reconstruction, where the plastic surgeon comes in, is to recreate a new breast where the breast has been removed. A significant part of my practice is breast reconstruction. I take care of the women, some of them right from the get-go when they're having their mastectomies. And I also see a lot of patients are referred to me by other surgeons from time to time for revision procedures for their breast reconstruction. There are lots of different options for breast reconstruction, and no two patients are the same, no two body types are the same, and no two cancers are the same. So there's sort of a huge array of or range of situations, and I can offer women pretty much just about any of the different options that are available. There are different types. So the big categories are, there's two big categories. One is using your own tissue, and if and when we do that, usually the best option is to take tissue from the lower part of the abdomen or the tummy to make new breasts. And really the state-of-the-art operation for that is the DIEP or deep flap breast reconstruction. That involves detaching the lower tummy tissue, and then it's detached completely from your body, and then it's reattached up in the chest by sewing the little blood vessels back together under the microscope. So it's fairly complex, but it's a very good operation, and a lot of women do very well with it, and some women, especially women who have had radiation or had trouble with implants, or some women based on their body type may choose a deep flap reconstruction, and that may be their best option. The second big category is using a product that's off the shelf. So no donor site coming from your own body. It's a sterile product that we use, specifically breast implants. For some women, they're able to go right to the breast implant at the time of the mastectomy, but for other women, we put in a temporary implant, which is like a spacer, called a tissue expander, which allows us to stretch out the skin and actually create more skin, grow more skin, and give us a good pocket, especially when some skin has been removed at the time of the mastectomy. We get a better pocket, so then we come back, take out that expander, put in the permanent, nice and soft implant, and get good results with that. There are other options as well, especially in the realm of using your own tissues. There are other parts of the body that can be used, such as the back, the upper buttock, the inner thigh. All of those operations I can do, I do, but typically if the lower tummy tissue is available, that tends to be your best result. It's easiest to hide the scar, and it usually gives you your best looking result. So for most women, the answer is usually yes. And I like to tell my patients that breast reconstruction is a process. It's sort of a journey. The mastectomy, which removes the breast, that's one operation. You may have other treatments. You might need chemotherapy, might need radiation therapy. But once all of that's done, the cancer part is done other than surveillance. But breast reconstruction is a little bit more involved, and most people are going to require more than one surgery. And that goes for using your own tissues, such as a DIEP flap or implant reconstruction. Some women can go straight to a breast implant, but a lot will have a temporary spacer put in called a tissue expander. which is in for a variable amount of time, but it helps to stretch out and create more skin to have a good looking breast. And then the tissue expander eventually gets hard because it's pushing from the inside, but then it is removed at a second operation and the permanent soft implant is put in. Most women are candidates for many different types of breast reconstruction, and the good news is there's lots of different options out there, all depending on your body, your treatment, your cancer, your situation, and what you need and what your desires are. So we have lots of options based on all those different factors.